this one diagram in which show tendons on medial side of the foot. Plantar ligament, these are ligaments extending from plantar surface of the calcaneum to the foot, giving rise to the longitudinal arch of the foot. Tendons related to the pathology of clubfoot are those on the medial side of the foot. The tendon immediately behind the medial malleolus is that of the tibialis posterior. More posteriorly are the flexor digitorum longus tendon, posterior tibial artery and nerve, and flexor hallucis longus tendon. The tibialis posterior tendon has its main insertion on the navicular. This is the most important muscle related to pathology of clubfoot. Now, nomenclature. Before discussing this topic further, it is wise to understand the meaning of the various terms. The first is equinus, calcaneus, varus, cavus, valgus, planus, and the splay. These are the types of the foot deformities. First is equinus, derived from equine, horse who walks on toes. This is deformity where the foot is fixed in plantar flexion. Calcaneus, reverse of equinus. This is a deformity where the foot is fixed in dorsiflexion. Whereas the foot is innervated and adducted at the mid-tarsal joint so that the sole faces inwards. Valgus, the foot is everted and abducted at the mid-tarsal joints so that the sole faces outwards. Cavus, the longitudinal arch of the foot is X-aggregated. Planus, the longitudinal arch is flattened. Splay, the transverse arch is flattened. Invariably, the foot has a combination of above mentioned deformities, the commonest being equinovarus. The next most common congenital foot deformity is calcaneovalgus. Now, etiology. First is idiopathic clubfoot. First is mechanical theory, ischemic theory. The last one is genetic theory. Mechanical theory, in which raised intrauterine pressure forces the foot against the wall of the uterus in the position of the deformity. Ischemic theory. Ischemia of the calf muscle during intrauterine life due to some unknown factor results in contractures leading to foot deformities. Genetic theory. Some genetically related disturbances in the development of the foot have been held responsible for the deformity. Secondary clubfoot. Following are some of the causes of secondary clubfoot. First one is paralytic disorders. Second is arthrogryposis multiplex congenita. Paralytic disorders in which muscles imbalance, inverters and plantar flexors are stronger than the everters and dorsiflexors. An equinovarus deformity will develop. This occurs in paralytic disorders such as polio, spina bifida and myelodysplasia and Friedreich's ataxia. The arthrogryposis multiplex congenita. This is a disorder of defective development of the muscles. The muscles are fibrotic and result in foot deformities and deformities at other joints.